Hi, good evening. Steve Adler. Got a minute? All right, so we're going to go through some numbers here. We're going to touch real briefly on some charts. We're going to talk tomorrow a line or two about the budget and the ballot that the council will be discussing tomorrow. But we're going to save a lot of time to talk to Bruce Elfant, who is in charge of both the census and registration here in Travis County. But let's begin by taking a look at the numbers. We'll begin with the dashboard. It's on the city site. Go to the city site. It's changed up a little bit. Today, we look first at admissions. We're up to 46. That's an increase of where we were yesterday. As you recall, yesterday we were like at 19. Number was really low. Number is low, 19. That reflects really Sunday's admissions that we have. So Tuesdays really measuring Mondays. People don't like to go to the hospital on Sunday. If they're making a choice, they're at home. They're going to stay home on Sunday and they go to the hospital on Tuesday. So we oftentimes see a bump on Tuesday. We see 46, but that still is a lot higher than what we have been looking at, and it just shows you that there's a lot of virus still out in our city. The 7-day running average, even with that 46, stayed at 34. We were at 33 yesterday. In terms of 7-day averages, hospitalization 7-day average is the 284. Tonight in our hospitals, 279, which means that we have a lower number of people in our hospitals tonight than our 7-day average, which means we're moving in the right direction. ICUs you see there with the spearmint or whatever color that is there at the bottom middle. 102 7-day average. We're below that in our ICUs, 98. So again, fairly flat, but still headed in the right direction. Ventilators, 7-day running average, 74. Number of people in ventilators tonight, 75, which is a little bit above our 7-day running average. But you can see basically flat. I'm expressing the concern again that we're plateauing. We can't afford to do that. We have to push down with our infectivity if we really want to be able to sustain the opening of schools and businesses. 296 cases today. The 7-day moving average is 204. That probably also reflects the same kind of weekend deal. We just don't get the numbers reported at the same rate on weekends, which means that Monday and Tuesday numbers are oftentimes higher. That's that cartoon sketch in the middle. We'll look at the real one in a second, but you can see that it's kind of plateauing. We're right in that area between the orange and the yellow area. Dr. Escott's keeping us in that stage 4 in the orange area because, as he says, the infectivity level in the community is still too high. Anything could set us back. And we have Labor Day that's coming up. People are nervous about people celebrating on Labor Day, having barbecues and picnics and with the neighborhood and that kind of stuff. Bad idea. Hope we don't do that. We have university students that are coming back this week. I hope that they recognize they're coming back to a community different than the one they left. I hope they're coming back ready to wear masks all the time, just like all the rest of us. I hope they come back, and if they're not feeling well, they quarantine, because we've heard that a lot of these students are coming from areas that have greater infection levels than we have. Let's go to the next dashboard page. You can see the green numbers in the middle are tonight's numbers for hospitalizations, ICUs, and ventilators. We've already discussed that. The 296 new cases we have today take us to 23,249. The number of deaths in our city, total 307. That's 4 people who passed away in the last day. Still a deadly virus. We'll talk about that in just a second. Let's look at a couple other graphs here real quickly. Anita, you have some that might be interesting for folks to see. These come from Dr. Escott, who is the health administrator here in the city. Works for the director of public health, Stephanie Hayden. This is confirmed cases in our city. You can see that the number reached that peak as we saw in June, coming down now. The confirmed cases, we're getting better at being able to use that as a predictive number, because now we have more and more of the testing agencies all sending in their data. So we're getting better data reporting than we had before. So many different places we're taking tests. It's going to enable us to be able to actually tell you of the tests taken, how many are positive. That positivity number is going to be one we closely watch. We're going to watch it not just in the aggregate, but in individual populations, African American, Asian American, Hispanic, Latinx, white community, Anglo. And the reason we're going to look at that is we have to get everybody down below 5%. Each individual section of our community down below 5% so that we can open up schools and sustain it and sustain opening up businesses. Let's go to the next chart. This is looking at doubling time. This is how long it takes for the number of cases to double. You can see that in June, we were down below 20 days. We got down, I think, to like 16 days or something like that. Our numbers were doubling every 16 days. You can see we're at one of the highest places we've been. We're up above 80. We're at 85 right now, which means the number of cases that we're seeing, new cases, is doubling every 85 days. That acceleration's come down, but we still have the virus. We still have to work. Next chart. I think we have one more to see. This is the new admissions chart that we looked. Blue is the actual number. Yellow is the 7-day moving average. It's kind of plateaued, maybe pointing down. We need it to point down more. I think it needed. I think that was the last one that we had. Hey, this is World Mask Week, organized by the Pandemic Action Network and the World Health Organization, the Center for Disease Control, the CDC here in our country. You can see the partners, Facebook, Google, Global Citizen, 40 other partners. It is an international effort pushing back against the myths, the myth that masks don't work. That's a myth. They do. Pushing against the myth that you don't have to wear one if you don't feel sick. That's not true. If we really want this to work, everybody has to wear a mask. It's hashtag wear mask, hashtag World Mask Week. Austin's doing a really good job. There are other cities around the country looking to see what we did to have a community that would be disciplined. They want to know if we started ticketing and putting people in jail. And it is, you have to have some measure of pride to say, no, we didn't do any of that. We just had a community that was willing to step up when it needed to do that. 30,000 foot view of the virus. United States now by far the worst affected country in the world. More than 5 million COVID cases, more than 160,000 deaths, dwarfing anything that you see with influenza, because we hear those myths as well. There has also been a 90% increase in the coronavirus cases among children in just the last 4 weeks. 90% increase in just the last 4 weeks. This virus is now hitting age groups that weren't being hit before. Anita, do you have the chart that shows in Austin our new cases here recently broken out by age? I think you had that, and I think I cut you off before I let you pull that one up. If you can pull that one up, this is an interesting chart. This is the cases in our city here in the most recent time frame, broken out by age. Before we were seeing that our greatest number of cases were in the older people in our city, but you can see between August 4th and August 10th, most of the new cases in our city, more than any other age group, 20 to 29. And then 30 to 39. I think that the older folks are doing a better job of face masking and isolating themselves and protecting themselves and not taking risks. And then we have other parts of the population more willing to take risks. And maybe they're not showing up quite as asymptomatic as they did before, or maybe the cases are not quite as low key as they were before. Take a look at that number. And that's what we want to make sure all the university kids see when they're coming back to the city. All right, you can pull that down. Thank you. But hey, the main thing tonight is let's bring in Bruce Elfant. He is the Travis County Tax Assessor Collector, one of my civic heroes in this city. We have one of the highest registration rates of cities in the country. We're not going to talk about that till the end, but this is the man that is responsible for that record, which is a wonderful one to have. But he is also the guy that is in charge of the census. Bruce, thanks for coming and joining our little group here tonight.
Thank you, Mayor. It's good to be with you.
Okay, great. Hey, we've talked about the census on this, and I try to urge people to go and do it. But you're like the main guy. Tell people what's at stake with respect to the census.
Well, first of all, Texas receives about $43 billion in federal funds each year. That's based on the census count. They apportion by population, and that's why it's so important to make sure everybody is counted. It's determined largely by the count, not entirely. In Austin, Travis County, we still have a third of our residents who haven't been counted, and that's something like 500,000 people. And each person is worth.
Can you get closer to your mic?
Yes, I'm sorry.
That's okay.
Each person is worth about $1,500 a year in federal funding, and so we receive something like $350 million a year in federal funding. And so it's important to make sure that we get everybody counted. Each person we don't count, we're leaving $1,500 a year on the table for other states.
How many people did you say in our area haven't been counted yet?
Nearly 500,000. We have about 37% of our community to go. And so it's nearly 500,000 people who have yet to be counted. And obviously, in the early days, it's the low-hanging fruit. And now it's the harder to count populations that the Census Bureau is working on.
So the money from this, it pays for school lunches and in some of those programs. It pays for housing for seniors, repairs to our roads, buses, and a lot of expenses that we're going to have. And if the federal dollars aren't paying for them, then we're still going to have to do them. And it means that local taxes have to go up in order to be able to do that. So think of this as kind of like a tax savings measure. How's the state doing relative to other states?
Well, Texas didn't allocate a dime for census outreach. California allocated about $150 million, and most states allocated a lot of money to make sure that the count was accurate for their states. And almost every state had a complete count committee at the state level, and Texas hasn't done either. They didn't put any money in, and they didn't even set up a complete count committee. So they've left it to the local governments and local organizations to try to do the best they can. Texas, and as a result, Texas ranks about 40th among the states in the census count, and that's just shameful.
What's the percentage for the state, Texas, right now?
We're at about 56%, I think. I think the national is about 60%. The good news is that of the top cities, Austin is ranked second in Texas, and Travis County among the top counties is ranked fifth. What
city's ahead of us?
Fort Worth. Fort Worth. You got to be gunning for them.
Really, we need to pick that up. But that is true. Yeah. So other states in the country recognizing that it meant billions of dollars to their state. And remember, this billions of dollars is in part the money that we all pay as taxpayers, right? We pay our income tax. It goes to Washington, and then Washington just takes that money and then sends it back out. And the bad part is that if we don't get counted in states like Minnesota, which I think is one of the really high states,
yes,
send all our money in, and they're going to end up getting all their money back plus some of our money. And for that reason, the states contributed a lot of money to run advertising campaigns, to organize people. You said California spent $150 million. Texas, as a state, in order to bring home that federal funds, spent nothing. Travis County and the city of Austin reached into our coffers and put some money together to have a complete count here. and we're going to do the best that we possibly can. So this census, is it kept confidential? Is this
Absolutely.
information?
Yes, absolutely. It's kept confidential. The data cannot be seen by any government agency or any organization, any individual for 74 years. It is absolutely kept confidential.
Okay, and then it's required by the Constitution to do this. But I just heard, did I just hear recently that the federal government shortened the period of time that we would be counting people?
Yes, they did by a month. And in the middle of a pandemic, when we started late because of the pandemic, it is inexplicable that the federal government decided to end early. And that means that it's going to be that much harder to achieve a fair and complete count.
When does the count have to be completed by? When's the end?
The end is the end of September, both the on the ground and online. And the Census Bureau just started the on the ground count last week. And at the rate they're going, it would take about 66 weeks to reach every household that they have to reach. They have 7 weeks. And so that's what we're up against.
Well, we are fighting for the ability to bring home some of that federal money. Is there anything that the Congress can do to extend some more time to give states like Texas and cities like Austin more time to finish?
Absolutely. There's a bill on Mitch McConnell's desk that passed from the House last April to extend the census. They knew back then that they were going to need more time. Unfortunately, that bill hadn't gone anywhere, but absolutely the Senate could pass that bill and provide all the communities around the nation more time to get a complete count. And I hope that those who care about getting a complete and fair count will contact their Texas senators.
And what are you doing here? And what is the Complete Count Committee, which has lots of volunteers? What are you doing in Travis County to try to drive our numbers up here in the remaining 7 weeks?
Well, the first thing we need is for anybody who hasn't been counted yet to go to mycensus.gov and get counted. We need people to share the information with anybody they know. Students in particular are not necessarily aware that they need to be counted. They think that they're going to be counted by their parents. But the census says that you're supposed to be counted where you were on April 1st of 2020. And for the students who are here at UT or HT or Concordia or whatever on April 1st, they're supposed to be counted here. And they're not going to be included by their parents. So we need to get the word out to students. We need to get the word out to our communities of color and our immigrant communities who have a justified fear of the census. And we need to convince them that this information is not going to be used for any purpose other than apportionment and federal funding. So we have some challenges. We're going to be partnering with the City of Austin Public Library, sending the bookmobile out to hard to count communities. And they're going to be working on encouraging people to complete the census and to register to vote. So we're going to be partnering up on both of those. And we're also looking for suggestions on other places that the bookmobile could go throughout the county. So if you have any suggestions, we would love to hear them. And so we're going to be doing more phone banking and as much outreach as we possibly can. We want to make these 7 weeks count as much as possible, knowing that that we are going to be undercounted, but we hope that we minimize it.
And can people volunteer to help? I mean, because I guess at this point, it's volunteers that are phone banking or reaching out to the folks that haven't been counted yet. Do you take volunteers?
Absolutely. They can visit www.atxcensus2020.com to sign up to be a volunteer. And we have a number of volunteer activities that we would love for people to be doing.
Okay, that's great. Bruce, thanks for coming. Before I let you go, talk to everybody about voter registration. How are we doing and what should people know about that?
Sure. Voter registration is going very well. We're having a news conference tomorrow to announce a text to register app to allow people to register to vote safely from their homes. And we'll be talking about other ways that people can safely register to vote. Obviously, the pandemic has changed up everything we do. And we're having to try to rebuild what we do safely. And we will get there. We want everybody to register and we want everybody to vote. This is an important election.
Well, I hear tell we're going to have more people vote this time than ever before, but you can't vote if you don't register. So now's the time to reach out and do that. Hey, Bruce, thanks a lot for coming. Thanks for what you do in this community. Thanks for the work on the census. Thanks for and it's true what I said, right? Didn't Austin have some of the highest registration rates among cities?
We have the highest registration rate of any urban county in Texas, and our turnout is usually among the highest anywhere in the state as well. So I'm proud of our citizens, and we have to keep it up.
I am too. Bruce, thanks a lot. Thanks for coming by.
Thank you.
I'm going to close tonight in honor of World Mask Week. I'm going to be adding my masked face to the campaign. They've asked me to take a selfie, which I'll do here in just a moment, and I'll send it in and post it to make sure that it's something that we're doing. We're going to make Austin a force in this international campaign. Let's keep doing what we're doing. Drive the numbers down. Let's lower the infectivity. And you all take care. Be safe and good night.